Hi, Jeremy Cordeaux in the Court of Public Opinion. I'm just on air here to let you know that we'll be live streaming the Court of Public Opinion every Friday between 9 o'clock and 12 on jeremycordeaux.com. Please join us. We'd love to have you.
Hello everybody, welcome to this Talking Tendons podcast. My name is Prof. Peter Meliars from Monash University. I'm going to talk about today a narrative review. If you haven't seen it and you're interested in Achilles tendinopathy, have a look at it. It's open access, published by the Journal of Physiotherapy. It's an invited narrative review on the physiotherapy management of Achilles tendinopathy. And I'm just going to bring out a couple of examples from that narrative review. Today's episode is going to be talking about outcome measures. Two of the outcome measures that were included in the important outcomes or outcome domains, I should say, to assess in tendinopathy people were psychological and pain with loading. And this was in the consensus work that we did a few years back. Have a look at the paper, Vizencino 2019, BJSM. I'll link it to this Talking Tendons podcast as well. So I'm just going to pick up on pain with loading and kinesiophobia and talk about those. Now, we do talk about in tendinopathy this sort of proportional load-pain relationship, which is important for diagnosis. So if you have an Achilles patient and they do a calf raise, they report 3 out of 10, you would expect that if you got them to do a hop, the pain would be higher than 3 out of 10. Now, that generally does happen, but one of my PhD students, Igor Sancho, has recently completed some data collection looking at biomechanically looking at the forces in the Achilles tendon and relating that to pain reported. And what he found was interesting and probably shouldn't be surprising, but given we have bought into this sort of thinking about a proportional load-pain relationship, it sort of, when you think about it on a surface level, it goes counter to that. And what he found was that even though we saw this increase in force with going from things like calf raises to hopping, the pain that people reported with those activities was hugely variable and not really related to the force going through the tendon. So although on an individual level we see a proportional load-pain relationship, if you look at a group level, expression of pain is highly variable and likely to be influenced by other factors, not only force. So what we can say is that pain is not a surrogate for tendon force, and as I say, that's not surprising for us because we know pain is biopsychosocial. So that work is not published yet, it's under review, but I wanted to mention it because it sort of relates to some of the other points that I want to make today in relation to these pain with load outcomes and kinesiophobia. So pain with load is a good outcome, but we need to also consider that it's not a surrogate for force. Okay, that's the first point. The second point that I want to make about the pain that people report is that it can be influenced, as Igor's data shows, by other factors. And one of those factors is most likely kinesiophobia, and that is fear of movement. And, that's rooted in beliefs that, there may be damage with pain, that they're going to get, that they may get worse if they load, those types of beliefs, okay? So another PhD student, Sanam Tavakoli, has recently had a paper. It's still, this one is also still going through review, but she has presented the data recently at a conference, and it will be available soon. She looked at 30 people with Achilles tendinopathy in a cohort study, and she was interested in their daily activity So daily time spent walking and running is one example, and we measured that with IMU sensors attached to the person's ankle. We measured that over a week, so they wore the sensor for a week. And then she was also interested in daily pain intensity and the relationship between activity and pain intensity. What she found, and this is a summary, I definitely recommend having a look at the paper for further details, but what she found was that there was a relationship, as you might expect, between daily pain intensity and also daily time spent walking and running. However, the relationship was influenced by kinesiophobia. So people with low kinesiophobia had a better relationship between activity and pain. People with high kinesiophobia had a lesser relationship between daily activity and pain, which indicates that people with kinesiophobia influences the reporting of pain. So the way that people report pain may be influenced by their kinesiophobia. Okay, so that was interesting. Now, in the same cohort study, Sunam also found that there were moderate correlations between kinesiophobia and activity measures, both self-reported and the IMU measures that I mentioned. But there weren't as strong and certainly not significant correlations between severity measured with the VISA for these Achilles tendinopathy people and self-reported and IMU measures of physical activity. So it seems to be that kinesiophobia influences how much people walk, possibly more so than their severity. So what we're seeing is that there's possibly influences on participation. There's influences on the report of pain with kinesiophobia, and this really relates also to what Igor has shown, and that is that forces are really not the full story when we're talking about tendon pain. So this all is interesting, and from a clinical point of view, it sort of leads us towards thinking about kinesiophobia a little bit more and also measuring it in our practice. Now, Ruth Chimenti from the US has recently done some work in kinesiophobia. So there was a study where they looked to validate for Achilles tendinopathy, or at least partly validate the 11 question version of the Tampa scale for kinesiophobia, and that's the one that I would recommend that people use. It's pretty straightforward. It doesn't take long. There's 11 questions related to kinesiophobia, and the Chimenti paper from 2021 in Frontiers in Pain Research. They have they've looked at defining what could be considered as high, moderate, low, and minimal kinesiophobia. So, for example, if they score higher than 36, then they can be defined as having high kinesiophobia. So that's hugely useful in a clinical context for people with Achilles tendinopathy. So definitely have a look at that. The other thing that was really interesting that they did in this study was they looked at expected pain versus actual pain, and people with, and that's before they were doing certain load tests, people with expected pain, with higher levels of expected pain, also were more, with a higher discrepancy, so higher expected pain versus lower actual pain, were more likely to have kinesiophobia. So that's another expression of kinesiophobia that you can look for. Probably the last one that I want to discuss today is looking at apprehension. So often when we're looking at Achilles tendinopathy patients and we see them clinically, we see that they display apprehensive behaviours. So commonly it's with activities that they fear. So they fear doing things that they perceive to be potentially damaging or high loading for their Achilles problem. One example is hopping. So when you ask them to hop, you see a whole spectrum of responses from, yep, fine, no problem at all, to the other end of the spectrum, I don't want to hop, I'm not going to hop. In the middle somewhere, you see apprehensive behavior. So they set themselves, they look apprehensive, they look, they sort of display behaviours that sort of suggest that they're not happy to hop. So look for those apprehensive behaviours, delaying. What I mean by setting themselves is they might go onto their toes. They might go onto their toes to, before they start hopping, to sort of, reduce the load into dorsiflexion in the tendon. So they hop high on their toes. So that's just an example of what you might see. So in summary, look for kinesiophobia is important. It influences, we know that pain is not a surrogate. Tendon force is not a surrogate for pain. We know that kinesiophobia probably influences expression of pain, but also how much people walk. It probably influences expected pain before load test. So ask them about expected pain during your load test. Look for kinesiophobia. Look for apprehension during your load test. And also, if you want to quantify with a validated outcome, use the Tampa 11 question version of the Tampa, where we do have some validation. Have a look at the study. I'll also link in this Talking Tendons episode the Chimenzi 2021 paper, so you can have a look at how they validated, because it was quite interesting how they did it. So yeah, that's great. So hopefully that's helpful. I'll do a couple of other ones that are related to this narrative. This invited topical in Journal of Physiotherapy. I'll do a couple of other episodes of Talking Tendons. So I'll see you at the next one.
Hi, Jeremy Cordeaux in the Court of Public Opinion. I'm just on air here to let you know that we'll be live streaming the Court of Public Opinion every Friday between 9 o'clock and 12 on jeremycordeaux.com. Please join us. We'd love to have you.